Hi, my name is Sheila Wilson. I'm president of Stop Healthcare Violence. May I ask who you are?
Sure. I'm Christine Ayers. I'm a nurse in the ER at St. Vincent Hospital.
How do you spell your last name?
Ayres.
R-E-S. Are you any relation to Bruce?
No.
No. Just ask. He's a state rep in my community. So, tell me again your first name?
Christine.
Christine. Christine, why are you striking?
I'm striking for my patients, for my community, for myself as a nurse. Safe staffing or lack thereof has been an issue for a long time. Tenant has the means to fix it. There is a solution. Let's get it done so that our patients deserve better.
Do you find that the ratio of patients to nurses is a little bit higher than it should be? I mean,
Absolutely.
Like you can't go and so if I come in as a patient and I'm ill, really ill, you couldn't stay by my bedside for 5-10 minutes. You have to take care of your other patients.
Exactly.
And then I'd never know when you were coming back.
Nope.
So if you did an EKG on me, I might not hear the results because the doctor is busy if you're busy.
Mm-hmm.
My IV could run out.
Yep.
And it would go dry. And if I needed to use the facilities in any way, and I couldn't get up and walk, so that would cause a big problem.
Absolutely.
And those are just little things.
Yes, that's just the beginning.
And what would happen if I went into VTAC or VFib? The monitor would go, right?
Correct.
And then could you run fast enough to get me?
I would.
You would run
I
fast.
would run, but then I'm leaving my 4 or 5 other patients.
Yeah.
For
So
however long.
It really makes it very dangerous
Mm-hmm.
when there's too many patients and not enough nurses.
Absolutely.
I've been there.
Yeah,
So
it's not a good feeling.
No, it's not. And when you have somebody you have to keep an eye on, like you'd want to keep an eye on me because you never know what's going to happen.
Mm-hmm. Yep.
You can't keep an eye on 4, 5, 6 other patients.
Correct.
So what has changed for you since you've been out here on strike? Is it good, bad, indifferent?
It's been good. It's been a positive experience as far as the, feeling more engaged with the community. I feel really empowered to be able to, kind of take a stand for myself. It seems like a rare opportunity. But I miss my patients. I want to get back to doing what I love, but I won't do that until, there's safer staffing. Yeah.
Well, you don't want to lose your license.
Right. Right.
Because if you lose your license because you missed something, and then you won't be a nurse anymore.
Right. And it's on me. It's not on anyone else
and
if
so
something
you're
happens.
For this.
Mm-hmm.
And that's really important. Well, I certainly think that is very important. But now, how long have you been a nurse?
I've been here 8 years.
8 years.
Yep.
You worked somewhere else beforehand?
I worked up on the floor for 5, and now I'm down in the ER. But always at St. B's.
I worked the floors too. I worked in the units and I worked the ERs.
Yep.
I've had a great career.
Yeah.
And we also went out on strike, so I understand all of this.
I was on the line with my mom when I was probably 11 during that strike. I was with my mom. She's a nurse here as well.
Wow.
Mm-hmm.
Wow. All righty. Thank you so much.
Thank you.
And anytime that you talk to Beckett, I have a wine and cheese program.
Oh.
Come on in and chit-chat and get all this word out.
Yeah.
Just because if you go back, you don't know what it's going to be like.
No, right. Yep.
But don't stop fighting.
No, absolutely not.
It's for the patients and it's for the nurses.
Yeah. The longer I've been out here, the better I feel about my decision to be out here. Yeah. So.
Yeah. No, it's a hard decision.
Yeah. It was. Yeah. It was hard.
Well, I don't even know if it's still being recorded, so I won't tell you.